Okay, sorry about that, of introducing Morgan for our specialty session today. Morgan Livingstone is a certified child life specialist and an infant massage instructor and trainer who has been passionately playing with and supporting children, families, and survivors of retinoblastoma for over 22 years. Morgan is an advocate for positive touch experience for all children, but believes strongly in massage and regular positive touch for children after potentially painful early childhood cancer treatments. So we are pleased to have Morgan with us today to present to us. So I'm going to hand it over to her to just.
Hi, everybody.
Thank you.
Everybody knows me, but it's Morgan again. I don't need to go into a long explanation. And I will certainly, if it's easier for everybody to see my presentation, I'll turn off my camera when it's time. Just because there are some pictures, and I also have like a little handout, Genevieve, that I can send to you for members that want to know about adaptations for different age groups for positive touch, because I feel that not only do babies benefit from massage, but we all do. So I'm going to do a screen share, guys, and I'm just going to get my presentation ready. Okay. Excellent. If everyone can see that there's something that's popped up on my screen now, I'll shut off my camera if you guys want, so you don't have the distraction, and we'll get started. Hold on. There we go. Great. Okay. So child life, really, massage and the adaptations for the growing child are something I've been really passionate about lately, because I know about the benefits of infant massage for infants. And I've been working for many, many years with very young babies in that first year of life that are having aggressive treatments, painful procedures. And I noticed that we needed to extend that. I'm going to just give everyone a heads up that I'm wearing my headphones because my family is home and will most likely be wandering around behind me. So apologies in advance. But I am indeed, as Genevieve mentioned, a certified infant massage instructor, and I'm also a trainer. So I've been traveling the world teaching infant massage and the benefits of infant massage for all age groups for a very long time now. And I have a wonderful photo here, a World Eye Cancer Hope sponsored infant massage training for all of the Kenyan child life specialists and nurses as well that work with retinoblastoma patients. I had the pleasure and the privilege of bringing one of the worldwide trainers, Andrea, who you can see standing in that beautiful red shirt in the middle here. This picture includes all of the Kenyan Child Life team, as well as Sarah Ellen Mamlin, who is the past director of the Child Life program in Kenya. But the most amazing thing about my ability to provide massage and spread the word about massage is that it's always been facilitated by my work with retinoblastoma families. So the main reason why I became an infant massage instructor, because I could see that these young families with children diagnosed with retinoblastoma would benefit the most. So it's really what's driven my decision to become an instructor and then also a trainer. So now I can train professionals myself. So I'm excited and thrilled that we're talking about this, because I believe very strongly that this is part of those foundational supports, Genevieve, that we need to be offering families. All right, so why massage? What's the big deal, right? Why positive touch matters? Well, there's a great quote here, the power of touch cannot be underestimated. And it's from a preeminent professor, Tiffany Field, who is the director of the Touch Institute in Florida. And the majority of her research really focuses on premature babies. But in the beginning of my work, I really focused on babies with multiple medical needs and mostly babies with retinoblastoma. I knew that the pain information that Tiffany's preeminent research was proving, that if we provided massage, that children coped better in the NICU environment, that they were able to go through painful procedures better and cope better through them, and that their level of pain was reduced, really informed my work with what is essentially quite painful procedures for very young babies when they're diagnosed with retinoblastoma. And here I have a picture of a dad holding his baby. This is a family that I worked with in the United States, and this baby was diagnosed with retinoblastoma within the first 2 weeks of life. So we knew something was wrong at birth, and the doctors quickly hustled to figure out what was going on. The family was nervous and a bit hesitant too about what could potentially be said about their brand new baby that looked so perfect. But with a lot of support and a lot of hands-on kangaroo care, here is what you see. The family was able to make the right decisions, and their baby is surviving and thriving. This was 22 years ago. So it was one of the first opportunities I had at a very initial diagnosis to really advocate for positive touch for a baby that was going to receive enucleation. So there are so many benefits to infant massage, and it's not just for children that are unwell, but for all children. It really benefits all babies of all ages, and helps relieve discomfort, gas, colic, and constipation. It really improves circulation, aids in digestion. So all these things that we want to see in a healthy baby, enhanced development of the nervous system. It really stimulates neurological development, increases alertness and body awareness, reduces stress hormones, and improves immune function. And also releases oxytocin, which is a lovely nurturing hormone that helps us relax. In this picture, you actually can see a little one that is one of our babies in Kenya. This baby had been very badly injured. You can kind of see that their arm is covered in a bandage. And before a very painful bandage changing that had to be happening every other day to promote healing and reduce infection, this baby received massage. And you can see how tiny this little one is. This is an abandoned baby, so it's in the care of the hospital. So the baby was provided with massage before, during, and after a painful dressing change. They also were provided with a soother to suck, which helps them promote coping as well. And the baby survived and thrived despite these incredibly painful procedures with no pain management. So the positive touch really was a part of the pain management plan for this baby. It also fostered healthy bonding and attachment, just like it would with a parent, but with the staff and the caregivers at the hospital for a baby that didn't have a family. If adults can get massages, why can't babies and children of all ages, right? If you have a sore back, David, Genevieve, you go get a massage, right? But we don't always afford that to our little friends. When they have an ache or a pain, we don't always provide positive touch and massage, and we certainly wouldn't seek out a massage instructor or an RMT to help with that. But it's something that parents can provide, and it's literally at no cost. It is available at all times. So massage that becomes routine also can help cue young children, especially babies, to certain times of day. You know, if you're looking forward to putting your child down for a nap, you can cue them for that nap by giving them a certain type of massage. And that massage is like, oh yes, it's almost time for nap. So we're going to get into that nap mode. Similarly with bedtimes, if you wanted to do a bedtime massage after their bath, but before their story time, it's a great way to cue children, especially when you're in different time zones. So given the fact that I've been working in Kenya since 2006 with Brenda and Helen and the retinoblastoma team, it's been great for me to cue my kids when we're in different time zones that it is still indeed time to have a nap or time to have a sleep, even if the sun is still up. So it's been a great tool in my toolkit. So keeping the connection, why do we want to offer massage for growing families and when children are no longer babies? Well, this touch really can continue to keep the strong bond between parents and babies and children of all ages, right? It also helps keep the lines of communication open. We all have the equipment to do this, guys. This is it. This is it. This is the high-tech equipment. And occasionally we can add things like special lotions, and we can add oils and stuff that will help our children, of course, experience massage in an even more positive way. But this massage really promotes time for parents and the child to relax and manage stress. I feel like we keep forgetting that we adults, if we're feeling overly stressed or tense, we'll absolutely massage our own shoulders or ask our partner to massage us, or we will seek out massage from a professional. So it's not often thought of for children, especially when they're experiencing stress. We just expect them to be able to play it out or to fix it themselves. But this is a nice thing that we can offer them. So massage, again, can help establish a family tradition. And if you massage your children, guys, they will massage you eventually. Trust me. I've been testing out this theory on my own kids, right? And I hope, Jennifer, you are doing little back scratches right now. I'm going to give you some ideas. But the opportunity for the parent and child to kind of talk, communicate, and spend time, like giving children a relaxed time to express their feelings, is really important, especially as they grow older and they want their independence. This almost helps us with that line of communication, rubbing each other's backs, or whether it's a little shoulder rub, anything like that, that really promotes our time together and connection is really important. Start early and establish a routine. That's the best advice anyone can give. But I've got some great ideas for kids as they grow. So for active crawlers, yes, guys, those toddlers that never stay still, you can actually adapt massage strokes. So most of the infant massage strokes that you saw in those earlier slides were babies laying on their back, which is so important for fostering that connection and communication. Even for a baby that is visually impaired or is blind, to be able to face the baby and to wrap your sound around them. So the engagement, the songs, the communication, the conversation is still connecting you to them. And that wonderful ability to kind of face the baby and wrap yourself, whether it's visually or through sound, around them, is a great way to engage them. But toddlers may not do that for you. I think toddlers' favorite word is no. So massage the body part that appears in front of you is really one of the best notes of advice. And here's a little toddler who literally was just about to crawl away, but found a nice comfy position, because once you begin the massage, and this is just stroking from the shoulders all the way down to the buttocks on this little guy, you can see he paused as soon as he realized how nice that felt. And he stayed there for an extended period, which is unusual for toddlers. They usually don't stay still for longer than 30 seconds, if that. But using toys, songs, rhymes, and verses to catch the child's attention is another really great way. Be creative, be silly. You can even do a variety of positions: laying, sitting, and hugging. It's not uncommon for me to start with a toddler with having them draped across my legs, do a little bump up and down ride, and then start the massage. So you kind of provide that boisterous, athletic, movement and rigorous movement play, and then you go into the massage, because who doesn't like a little lap ride? So trying before and after bath time for a toddler is also a great idea, because they typically calm down. And I may be jinxing a parent's ability to do this by saying they calm down, but they typically do have periods of time where they're more quiet and alert. And that's a great time to connect with them. They may be more receptive at those times. Start with permission. As soon as babies are able to connect and communicate with you, through any kind of engagement with infants, I always like to invite massage. So a parent can say, "Are you ready for massage?" And the baby will give you cues. If a child, a toddler, or an infant is not interested, they will give you a disengagement cue. And I'm sure you've all had that experience. Jennifer, maybe we could model that right now, but a young child putting out their hand like this, or an infant turning their head away, is giving you a very clear disengagement cue. But starting with permission also teaches children about consent as they grow older, and that you will always ask for permission to touch. So taking a deep breath and making sure that you yourself as a parent or the caregiver is calm, relaxed, and ready to give massage is also really important. If you're stressed, or you're just not able to calm your own self and your own breathing and to regulate your own self, it isn't really a good time for massage. Sometimes if your partner's able to do it on those days when you're overly stressed, it would be good to seek out support from them. However, if you feel that the benefit of calming yourself in order to give massage is going to be helpful for you, then I would fully support that. I think that we as parents take on a lot of stress right now. There's a lot of pressure to perform and to do things a certain way, and you never want massage to be that way. It should just come naturally, and it should be pleasant and a joy. And lastly, have fun. Toddlers are absolutely silly, and you may end up talking about, scratching their back or rubbing their bellies because you want farts to come out. Whatever works, because humor is so important when you're working with kids. And sometimes, having a laugh attack while you're doing massage is okay. In fact, I would promote it at all costs. So toddlers are really at a tremendous period of growth and independence. And this is, of course, when we're talking about families with retinoblastoma, this is typically still a time when there is ongoing and continued assessments and potentially procedures going on. So to provide something that is positive and not painful, that involves touch in a way that promotes acceptance of touch and is not going to hurt them, is such a wonderful experience for these wanting to be independent toddlers that of course have to undergo examinations under anesthesia and other aggressive treatments. So many toddlers may say no to things that feel safe, including massage time. Like I said, no is literally like a standard response. So you may say, would you like a banana? No. Would you like an apple? Would you like a cookie? And they're going to continually say no until they realize they've just said no to one of their favorite things. So similarly with massage, although no is a favorite word, still giving them a choice. You know, do you want a massage on your back or do you want a head massage today? You know, would you like a massage on your hands? Or would you like a massage on your feet today? Giving toddlers a choice because they are absolutely and most importantly wanting to be more independent. They're wanting to make some decisions in their life where they really don't have a lot of power, especially when they're in active treatment or continued assessment. So giving them a choice actually almost tricks them into picking something that will still promote that positive connection and that positive touch. So the most lovely opportunity for you is to say, you know, this or that, you know, first we'll do back, then we'll do head. And it appears that they've made a choice and it gives them an opportunity to not say no, but to select the one that they prefer. Naming the body parts that you're massaging also gives you a chance to help communicate what all the parts of the body part are actually called. Because a lot of the time when we have a child who's not feeling well, it's hard for them to articulate where they're feeling pain or what is painful. So going over the body parts and talking about each of them as you massage is actually teaching them how to understand their body, how to identify and connect with different parts of their body, and to also be able to probably more accurately give you a sense of how they're feeling in that body part. So for some children that might have tummy trouble after some kind of medicine, or if they're just not feeling well, you can accurately go through each of the body parts and say, how is this part feeling? Is it feeling good or is it feeling not so good? You know, is it feeling happy or is it feeling sad? Any adaptation like that really helps kids communicate, and you're scaffolding the learning about each body part. Songs and repetitive chants are really fun. I mean, this is where this new wonderful device, YouTube, has provided Coco Bellin to so many parents right now, where they do have really great songs and nursery rhymes that can easily be adapted to teach children things. So it's not uncommon for new songs to include things like putting on your sunscreen, anything like that. So we can even pretend when we're doing that and give really important information. A lot of the retinoblastoma child life presentations I give also talk about preparation and preparation for different assessments and helping children almost through exposure therapy. So a lot of what I also want, adapting to those changing positions and even provide the massage while standing is really important. But one of the things that's amazing about providing positive touch for older children is that can continue to include different massages to the face that help acclimatize or help toddlers gain comfort with people touching their face, which of course is something that all of our ophthalmologist friends do constantly, and ocularists with children that have retinoblastoma. So working around the face, helping with stuffy noses. There's a wonderful massage that's called Happy Sinuses for children who get a little bit filled with boogies. But all of these things will help again with that positive touch and really help providing relief when it comes to discomfort. So toddler tips, really just think of playful ways and games to incorporate massage, such as planting a garden. So oftentimes, Jennifer, if you and your daughter want, you can do planting a garden on your back. And I usually plant a little seed and then I grow the flowers all around on the back. Another thing is making pizza. So I'll mush the dough and then I'll put the sauce on and then we'll sprinkle the cheese. But all of these fun and silly ways really still are just delivering this wonderful opportunity for positive touch. And it's kind of funny. And kids will do it for you too. So making pizza, kneading that dough, you know, spreading the sauce side to side, sprinkling the cheese, popping the pepperonis on. All of those little things are different aspects of positive touch. Listen for coded ways that toddlers will ask for massage or cuddle time. Sometimes they don't just know how to say like, hey, mom, I need a snuggle, or I'd like a hug or a massage. Sometimes they feel like they need to act out or be sick in order to have this wonderful cuddle time if it's not part of your daily routine. So pay attention to that. Toddlers are usually interesting communicators and will sometimes act out in order to get the love and affection and attention that they so desire. So my mom isn't doing anything with me while I'm being good and I'm playing nicely by myself. But if I act out and I'm a total jerk, she'll run after me and she'll hang on to me and I'll receive the touch that I want. So always doing that detective work when you have a toddler is so important. Trying for a consistent time of day, of course, helps prevent that manipulation of circumstances. So if you do that before or after bath or right at bedtime, that will really help toddlers with that. And of course, think about touch as like a vitamin that you're giving your kids every day. You know, you wouldn't miss out on taking your vitamin, or you wouldn't miss out on taking a certain medication, and you shouldn't miss out on touch. So here's another great age, preschoolers. Learning is fun. So here we begin to adapt massage for longer limbs, longer legs, longer arm strokes, and they can be done first on the upper part of the limb and then on the lower part. This is really a time when your child may ask for massage and then give you one as a parent. You can add scented oils or lotions to make massage very personal and special. This is when you're really extending the massage, and the massage becomes so much a part of the routine that kids can make decisions about it. So as I held this up, this is a lotion that I make with my kids. They can personalize it with their own essential oils. It's a coconut oil based one with honey. We use a special kind of instant pot cooking to do that. But Genevieve, that's for another presentation. We can do that. That would be a really fun activity for us to all do, is making our own personalized massage lotion. I think, Jennifer, you'd have a blast, you and your daughter, making your own personalized one, because you can really pick your own scents. And there are some stimulating scents and there's other relaxing scents, but it's a lovely, again, activity for you to do with your preschool child or school age. In this picture, I wanted to show a young retinoblastoma patient in Kenya that's receiving massage. This patient was one of many patients, of course, I'm preaching to the choir, speaking to retinoblastoma supporters here, but this little girl's name is Helen, and she was quite fearful at the hospital because none of the doctors or the medical team would ever introduce themselves before they walked to her bedside and before they touched her. So her experience of touch was incredibly negative, usually quite forced. You know, they would be moving her body around without explaining what they were doing. She didn't know who they were, and it was overwhelming and quite scary. So you can see how slowly we introduced massage. This is Ernest Kirui. He's one of the managers of the Child Life program, and he is an infant massage instructor. And he is slowly introducing massage by just allowing her a chance to feel his hands. So slowly over time, we worked with Helen, and this is her grandmother, her primary caregiver. She's actually receiving chemotherapy. There's a tiny line that you can see going up in the picture of her receiving chemotherapy while she's receiving massage. And this was all facilitated by the fact that she experiences a significant amount of gas pain when she receives her chemotherapy. So we were working towards teaching her grandmother the strokes on the tummy and the back that would help her relieve pain. So pain management doesn't just apply to infants in pain. It applies to all children of all ages that are experiencing pain, especially during treatments. So we slowly introduced massage to Helen and her grandmother, and they were able to quite successfully manage her pain in future chemotherapies. So here's another picture of Helen. We were moving towards the face because what is going to clearly happen soon for this child, as you can see, there's a bandage. She's just had her eye enucleated. So slowly, we were going to be working towards removing the bandage, but providing positive touch on her lips, on her forehead, and on her cheeks was our goal first, so that she wouldn't be fearful and that she'd be well prepared and feeling comfortable and confident before we began to remove the bandage. So everything that we do really has purpose here. For preschoolers too, in general, preschoolers find storytelling is a great way to do back strokes, arm strokes. You can literally tell stories about anything. My kids and I, we would call them mouth stories, where I would just make up a story, an adventure about why Finn and Faye would be flying all around the world to find the best bananas and the most tasty treats in the world. So we would do massage while talking about silly stories. I also like to, at this age, explore various strokes and different types of pressure and speed. This is when, if a child wants a more aggressive, scratchy back scratch, this is when they can start to really give you feedback about what they like and if they want a deeper pressure. Of course, respecting and honoring modesty is usually something that I want to encourage too, and have the child let you know, would you like me to reach up inside your pajamas and give you a back scratch, or would you like me to do it over your pajamas? All of these are easily adaptable, and I really like giving children a choice. And of course, as I said earlier, use the real terms for body parts and have open discussions, and certainly field questions about the body. A lot of the time kids don't understand, and it's a great opportunity for us to talk about our body and what the actual body parts are, and what their names are. So I really want this, communication line to be open, and through the toddler and preschool years, we're planting those seeds to improve communication. So school agers, as I was saying, guys, when you actually have children that are experiencing and receiving massage, this is one of the first groups of kids I ever did when I first learned how to massage. They were an infant group. It was a moms and tots group. And now they're big kids. And look at what they're doing. We had a little celebration, a gathering, and getting together, and they were massaging each other because their moms had continued the massage and kept the connection long after they were babies. And I asked if they would mind if I took a photo of them giving each other massage. So here you go. It is such a joy to see boys, especially, involved in positive touch. So here we continue to adapt strokes for growing limbs. Kids are going to get bigger, and those arms and legs are going to get longer. My son is now taller than me, so it's especially fun when I'm trying to provide any massage. But certainly introduce the massage by offering it after sports. Many kids are engaged in sports, if they have games, practices, or different types of activities. That's exactly when we adults would seek out massage, and so should kids. Whether they are just have overdone it, or if they've actually pulled a muscle, we always want to provide some positive touch. And of course, continue to offer it after post-medical appointments. For school agers that are still continuing to have follow-up with the team at Sick Kids or at any hospital, we still want to make sure that they have the ability to connect with us and to feel relief after a medical appointment. Examinations under anesthesia can leave a child feeling groggy and a little bit unwell at times. So this is just a great opportunity to really promote their coping and to help them feel better. Creating computer downtime, and especially right now through the pandemic, away from screen time, it's a really protected time for massage and relaxation, where there doesn't need to be a screen. You could certainly select music, which is another great way to connect with kids. But being present with your child is really important when we have so many distractions, especially the screens lately. So I have a picture here of a young patient that I work with because I wanted to let you know how children that have experienced very, very big traumas in their life, whether it's a medical trauma or it's the loss of a loved one or a car accident, which is a population that both Genevieve and I work in, it can really benefit children that have had a very disruptive traumatic event happen to feel connected to their parents through massage and positive touch. It really helps them foster emotional regulation and open communication with their parents when something traumatic has happened. The touch is an important opportunity for one-on-one time. Honoring modesty again and letting children decide when and where and what they'd like to be wearing is important. And relaxed music is really nice. Helping kids find music that speaks to them and helps them relax is really important. Or if they want to listen to something inspirational, then that's fine too. The child will help guide you. And you can absolutely still play with story massage. Many school agers, we assume, don't want to do baby-like activities, but it's really up to the kid to decide, because it's sometimes fun to tell hilarious stories that you make up about your children and the adventures that you go on as a family, and you don't want to hold back. But this young patient here was in a very traumatic accident. He sustained very serious injuries that needed surgical support, and he did not cope well after the trauma. A family member also passed away, was the younger brother. So we have very serious injury, we have very serious accident, and then we have the loss of a loved one and a family that was grieving. And this child's world was turned upside down, and what's helped bring them back was touch. Late, like he's a big kid, but late in life, doing yoga, receiving massage and positive touch from his family has really helped mend the bond that this very traumatic event has. So I feel strongly that with retinoblastoma families, especially children that did not receive enough support. I mean, I'm thankful for the fact that we've all been doing everything we can to advocate for more and better for families. But if there's ever a child that feels that they haven't coped well and that are experiencing trauma as a result of treatment, I strongly suggest and I strongly encourage families to include touch. It will absolutely be a game changer. Teens, oh, my favorite. One of the most marginalized populations past infants is teens. They do love massage, trust me. It's really that opportunity to continue to build positive self-esteem and body awareness. Massage may be beneficial to relieve sore muscles. Like, yeah, if you've got an athlete in the house, why not provide massage? But also for young girls, cramps and other aches and pains. Even if there's an ache, I know that many of our retinoblastoma families talk about aches, especially in the socket when we have an ill-fitting prosthetic, and providing positive touch around the area can relieve a significant amount of pain. Massages, of course, could be done over the clothes, at the computer desk, a shoulder rub at the computer desk. I think everybody loves that. The family room floor tends to be where we end up providing massage. So the child is sitting on the floor and I'm sitting on the couch and giving a nice deep shoulder rub, but really wherever a teen chooses. Adaptations are naturally going to be important. Sometimes head scratches are all they can tolerate, or hair brushing, and all of those are positive touch, guys, and they all promote connection and touch. It doesn't have to be limited to a full body massage, right? And for many teens, you don't need to use oil. They might have a very specific lotion that they've chosen. I especially love the teen boys and their Axe lotions that they've selected. It's lovely to be vibing in the Miami Vice when we have a massage. But, one thing that I also recommend for families is that at this point, teens, who are interested in getting their nails done equally would be interested in going with a family member for joint massage. So sometimes you can go with your friends. There's couples massages that are available. There's group massages that are available now where you have two RMTs providing massage at the same time so you can be together. And it's a wonderful bonding opportunity. So if you've kept the connection and you're able to offer massage through most of your child's life, it isn't far for us to assume that you could also include a professional massage with an RMT, and just a great way to have an outing together. Seriously, teens do love massage. I want you to always keep those lines of communication open. The touch has a magical effect on them. Finding a comfortable position, the floor, the bedside, or when watching TV or a show. Back scratches are great when you're watching a movie as a family. And teens more often, I find, respond just as intensely as younger children. I always want to tell parents not to be surprised if their teen really loves this experience. We assume a lot about teens, and teens, of course, assume a lot too. So if we could just meet them in the middle, and if we can just, support that connection, we'll all benefit. And this is an opportunity because this is a misunderstood population. Teens developmentally want to be moving away from the family, but for many of them that have experienced, early childhood painful procedures, early childhood cancer diagnosis and treatment, there may be one foot strongly in childhood because of the experiences that they've had, and then one foot in adulthood. So we always want to find a way to meet them in the middle. Why massage? Why not, guys? There's so many benefits. We really never outgrow our need for loving touch. I think that we've all noticed over the pandemic that there are times when we we haven't had a hug or a positive touch all day, and it's nice to be able to seek it out. It's really a gift to give it and a gift to receive it, and it really comes from the heart. Loving, caring families, if we can intentionally put touch in place, touch that feels comfortable for everyone, this can be a really wonderful, loving gesture. And massage from parents, of course, can help teach children that it's okay to be gentle and affectionate with others. And it nurtures communication and those positive messages from parents very early on in life, and helps kids develop healthy self-esteem and behavioral patterns. And it also is wonderful at regulating kids. Providing massage helps kind of unwind them for the day. And for many children that I work with that have experienced trauma, it's a wonderful way to connect without words even. All of these wonderful games that I've suggested don't have to be a part of the massage if the child just wants that connection with you. And as children grow and experience nurturing communication, they really learn how to be compassionate towards themselves and to others. So there is a self-love and a love for others that is experienced very deeply when you have this strong foundation of positive touch. That's the end of this presentation, guys, but I'm just going to pop up the massage adaptations as your child grows. So this is just a little handout that I typically will give to families. And Genevieve, if you feel like it would benefit CRBS members, I'm happy to give this. I mean, the presentation will be available certainly, and I'm happy to take questions, but this is just like a simple bullet point, massage adaptations as your child grows for those toddlers and active crawlers all the way up to teens. So there is a lot of wonderful ways. We're really only limited by our lack of imagination, guys, when it comes to positive touch. But I feel like this is a good boost for families to talk about this. So I'm going to stop sharing my screen and take any questions you might have. I know we have a very small group. And Jennifer, you and your daughter are welcome to ask me some questions if you have any questions.
Do you have a question? Well, I just want to say thank you so much, Morgan. And I wish that every parent, I wish that was just built in during pregnancy, what was happening. I mean, so this is my daughter, Michaela. She was born 2 months early. And
Michaela, I would be giving you a massage at the hospital for sure.
Well, exactly. So she spent a month in the NICU with wires and tubes everywhere. And then she had tummy issues for years, in and out of the hospital all the time. And I happened to go to my own massage therapist and just happened to be talking about the issues we were going through with her. And I didn't even know that my RMT specializes in kids. So then we took her to have massage to help with her belly. And she's never looked back, and she loves massages all the time and back scratches.
It's so great, isn't it?
Mm-hmm.
I'm happy to hear that you guys were able to find relief from massage, because it is a really big deal. And the neatest thing, of course, when you're a super tiny baby in the NICU is that it really helps you gain weight. It helps you to feel better and your heart beats stronger and calmer because you're relaxed. It's a really important part of massage. So that's a really amazing story, Jennifer. Thanks for sharing that. That's very cool. And I'm actually really happy that your RMT spoke up, because I feel like it's not enough people are aware of the fact that there are RMTs for kids, especially if there's some aches and pains.
This is great. I'm so grateful to be able to listen to you. I'm so wish that there was more advocacy around this when we were kids, and there was a better understanding, because I know we've spoken at length about my own residual challenges from the things that I was impacted by. And I hope that we've been able to take away some things, and some people in this group either have or are expecting little babies. So I know that some of the tools you've shared today will go into practice probably within a few hours. Even David might get to give Claire a massage later this afternoon. But
absolutely.
Yeah, sorry.
That's exciting.
Yeah, David has one and one on the way, right?
That's right. And it's funny how she does react to massage every now and again, just sort of the back of the neck, and all of a sudden you feel her shoulders go up like this, and she like shivers a little bit. It's funny to see.
Well, that's
She likes
awesome.
it.
How old is she now?
She is 20 months, so a little over a year and a half.
Active, yes. So
She
now
is.
you've learned there's a lot of adaptations because they're moving and shaking, but it is such a joy. And I mean, infant massage, which we really skipped over, works with all the body parts. So I always want us to think about that when we're thinking about big kids. I'll usually start with infants with the legs and the feet, and then we work our way up to the tummy, and then the chest, the arms, and the head and neck. And then of course, last is the back. So all sorts of really neat ways that we can promote touch. And I do find I provide massage to patients of all ages, by the way, guys. I feel like even when I'm working with an elderly person like my own grandmother, giving a hand massage or a foot rub can be such an intimate but incredible connection with someone that shows your love. You know, even your own partner sitting watching junky TV really changes when you offer to give them a foot rub. So I'm a huge fan of positive touch, especially post-trauma. Like, it is just for babies, especially Jennifer, I'm sure there was lots of heel sticks when you guys were at the hospital and all those tubes and painful procedures that have to happen. Sometimes we just provide resting hands, which is when you kind of cradle that part, you know, those feet and those hands and arms, because resting hands and just that initial loving touch without strokes is the beginning of positive touch. So when the new baby arrives, David, start with resting hands, which is that feeling of, you know, when you put your hand on their back and they sleep longer. It's that reassurance and that connection that you're there, and that it helps kids trust and feel connection. So I definitely envision, Jen, whenever we can, being able to provide more massage to families of all ages and stages. But and also that would be really cool for us to do a workshop where we can make our own lotion, guys. It's very cool. I do it a lot with some teen patients who, again, really need that connection. But this is a neat one that we can do with many of my families that have experienced trauma and that need positive touch, and it's personalizable. So, and it's all natural, like you could eat that. So I always want that when we're talking about babies. So David, if you do decide to massage your new baby, just use something very plain and unscented like grapeseed oil, because the baby wants to smell you and you want to smell the baby. You don't need any of those scented lotions.
Gotcha. Cool.
Yeah, thanks so much, Jen. And thank you guys for having me. I know I could seriously talk your ears off forever about this. And it's such a joy to be included in anything to do with the Canadian Retinoblastoma Society. So thanks for all you're doing, guys.
And we really appreciate your contributions and all the work you do with families and all the impact you have on to the families that are going through experiences, and especially retinoblastoma, because that's close to all of us. And so, you know, the information you share is invaluable, and we look forward to, you know, having the opportunity to discuss with you again in the future and on other topics. And of course, we welcome you and everybody to attend our in-person event in June, and hopefully we'll, you know, maybe do something fun where we can create something there. Like,
that would be great. I just found out, guys, that I will be working in Jordan, so a wonderful neutral country in the Middle East, for a week. And I think I'm flying back June 3rd. So it's a medical surgical mission where we're going to be supporting young children that have experienced burns and need facial reconstructive surgery. So there will be some children from Jordan and there will be some children from the Ukraine. That will be flown in for very specialized burn treatment from plastic surgeons. So I will be away for just that week leading up to it, but I will be bright and early because I'll be in a different time zone in my body, Genevieve. So I can most likely attend the event. I get back on the 3rd.
Good timing. Okay, good. Well, we'll discuss more when the timing gets a little closer, and we'll see how we can work together and have some reach so we can impact as many as possible on that day.
Excellent. All right, guys, I'm going to say goodbye. And Jen, thank you so much. I do look forward to connecting with you about the low vision booklet, because I would love to share that with child life specialists. And if there's anything anyone else has that you think would benefit Jocelyn and I in our presentation around low vision and supporting children and adults with vision loss, I welcome it. Thanks so much,
Great.
guys.
Thank you,
Bye,
Morgan.
Bye, big
Have a great
girl.
day.
Nice to see you. Bye, guys.
Bye.
Thank you.
All right. Well, thank you everybody for attending. That's concludes our AGM event for today. And hope everybody enjoys the rest of their day. Some sunshine.